আচ্ছা, আসসালামু আলাইকুম। আহ, আমার স্ক্রিনটা কি দেখা যাচ্ছে?
হ্যাঁ, স্ক্রিন দেখা যাচ্ছে কিন্তু কোনো কিছু লেখা দেখা যাচ্ছে না।
আচ্ছা, এবার দেখতে পাচ্ছেন?
হ্যাঁ, ইয়েস, দেখা যাচ্ছে।
ঠিক আছে, ফার্স্ট সিনারিটা কি করবেন? আমি ফার্স্ট সিনারিটা গ্রুপে দিচ্ছি। সিট পেয়েছেন? সবাই কি সিট পেয়েছেন? এখানে যারা জয়েন করেছেন সবাই কি সিট পেয়েছেন? আচ্ছা, আমরা স্টার্ট করতে পারি, হ্যাঁ? তো ফার্স্ট সিনারিটা কে করবেন?
হ্যাঁ আপু, আমি করি।
আচ্ছা, ঠিক আছে, তাহলে ভাইয়া আই এম গিভিং ইউ 3 মিনিটস ফর ইয়ার প্রিপারেশন, হ্যাঁ?
আপু, শুরু করে দিই।
ওকে, লেট মি হোল্ড দ্য টাইমার।
প্রশ্ন নিতে ইচ্ছে হচ্ছে না।
Okay, Bhaiya, I will give you 9.5 minutes. Okay, in real exam, you will get 10 minutes. Okay, you can start now.
হ্যালো।
Hello, doctor.
Okay, I'm Dr. Khan, one of the doctor of this clinic today, and I'm talking with Miss Maria, 29 years.
Yes, doctor, I am Mrs. Maria, 29 years of age.
Okay, Mrs. Maria, I'm going to talk with you about your health condition. Is it okay?
Okay, doctor.
So, may I know how about do you know about your health condition?
Actually, doctor, in the last couple of weeks, I have noticed that there is uncontrollable jerky movements of my body part. After that, doctor, I lost my consciousness. So my sister told me that I turned out bluish, and there was some frothy discharge from my mouth. So, doctor, after 5 minutes, I regained my consciousness spontaneously, and after that, actually, I remained confused. So, with this complaint, my sister brought me to your hospital, and you have done several investigation. You have done some blood tests and imaging of my brain, and some special tests to check the electrical activity of my brain. So, doctor, actually today I came to know actually what the test results are showing. Can you please tell me, because I am a young person, I am very much worried about of my condition.
Yeah, I must appreciate your concern. Yes, your test results in my hand, and I'm sorry to say that the result is concerning for us.
Oh my God, doctor. I mean, what the test result is showing? Do I have stroke?
Okay, I must appreciate your concern, Mrs. Maria. This is not a stroke, but you have a diagnosis what we call the epilepsy. Do you have any idea about this?
No, no, doctor. What is it?
Okay, the epilepsy is the disease of the brain in where there are some abnormal and uncontrollable firing occur, the electrical firing occur in the brain. That's why there are several manifestation of this abnormal electrical activity. That's why you may have some fits, may be shakiness of your body in your case. That's why it's occurred. And it is uncontrollable and nobody knows when it starts. Is it okay?
Yes, doctor. I'm getting you, but doctor, I mean, why it's happening with me?
Okay. Most of the time, there it is not found why it occurs, but there are some reason of occurring of this epilepsy, and in your case, it's not conclusive why it occurs, but it occurs.
Okay. So, doctor, what are you planning now?
Okay, all right. Yeah, we have some plan of management for you. There are some we need to take safety measurement also, and medication as well. Uh, are you with me?
Yes, doctor. I'm with you, doctor. So, doctor, I mean, is it curable condition?
Okay. All right, it's very difficult to say right now. Some patient needs a long-term medication, and some cases it's possible to stop those medication. But some other patient may need to take the medication very long period of time, and sometimes for the lifelong. In your case, it is very difficult to say right now what course your disease take. It's difficult to say. And we will form a multidisciplinary team for AU, including a nerve doctor, a specialty nurse, also a lady doctor for AU. And in the course of time, we may tell you about the medication can be stopped or not. Are you with me?
Yes, doctor. I'm with you.
Okay, all right. So may I going to detail about the safety measures you need to take? Should I tell you?
Yes, doctor.
Okay, all right. At first, may I know, do you drive?
Yes, doctor. I drive. I need to drive to take my child to the school.
Okay, Mrs. Maria, I'm sorry to tell you that you need to stop the driving and inform the DVLA, and they will assess you further, and they will tell you about the next driving. Now, is it okay for you?
But doctor, how long I need to stop driving? Because I'm a single mother. Because my husband died 2 years back, and I mean, how can I take my child to the school? Can you
I'm
provide me
very
some
sorry.
social support?
Yes, yes, of course. I'm very sorry for your loss of your husband. And yes, we will inform our social health worker. They will help you in this regard. Is it okay for you?
Okay, doctor.
Okay, all right. And other safety measures you need to take, right? You should avoid the height without the help of the others, and also you should avoid the swimming or any water swimming also and you don't need to lock the door inside. And you should be very careful about the using of the sharp object. Also, you have to avoid the fire, because if you have any epilepsy attack during all the situation I tell you, there would be more danger for you. Is it okay for you?
Okay, doctor, it sounds horrible. So, doctor, I am having planning for marriage in the next year. So, will my children have this condition?
Okay, all right. Sometimes this can happen in your children, but it's very negligible. And before the planning for the pregnancy, you need to talk with your lady doctor. And another issue is we will start the medication for you. Sometimes some medication may affect the children development. That's why that's why before the planning of the before the একটু বাবা, before the planning of the pregnancy, you need to talk with your lady doctor. Is it okay for you?
Okay, doctor. So, doctor, can I get pregnant? Is there any chance that this condition will affect my pregnancy?
Yeah, all right. Yes, you can
So,
get
one and a
pregnant,
half
but
minutes remaining.
okay, thank you. You can get pregnant, but you need to talk with your lady doctor first. And during the pregnancy, you need to get a regular follow-up. Is it okay for you?
Oh, okay, doctor.
Okay, all right. May I know what do you do for living?
So, doctor, I'm a housewife.
Okay, all right. Do you have any concern?
No concern right now.
Okay, all right. Do you smoke?
Yes, I smoke. I
Yes.
smoke 10 cigarettes per day.
Okay, smoking is very injurious for you, and I will refer you to the smoking cessation clinic for the cessation of the smoking. Is it okay for you?
Okay, doctor.
Okay, do you drink?
Yes, doctor, occasionally.
Okay, oh, you also stop the drinking, because it may be connected with your epilepsy, and it may worsen your epilepsy. That's why I will refer you to the Alcohol Anonymous. Is it okay for you?
Okay, doctor.
Okay, do you have any other concern?
No concern, doctor. But doctor,
Okay.
I'm using birth control pill. So,
Yes.
do I need to follow some precaution while taking
Yeah,
precaution?
yeah, of course, of course. Thank you very much for raising this concern. You need to take a precaution, because the medication we are using that may affect your birth control efficacy of the medication. That's why you need to take the other measures for the birth controlling. Is it okay?
Okay, so okay, your time is up. Okay,
Okay.
well done. You have, you have raised, you have fill up all the safety measures. আচ্ছা, এখানে যেটা একটু মিসিং ছিল সেটা হচ্ছে এপিলেপসির কিছু বলবেন, আরো কিছু সেফটি জিনিস আছে না,
Oh,
প্রিসিপিটেটিং কিছু ফ্যাক্টরস। হ্যাঁ,
yes.
এই জিনিসগুলো
Medication alert, bracelet.
মেডিকেশন অ্যালার্ট ব্রেসলেট না বলেন, বাট এটা এটা একটা ডিজিজ যখন আমরা এটা তো ডিজিজ ডায়াগনোসিস, তাই না, ডিজিজ
Mm.
ডায়াগনোসিস। সো একটা ডিজিজ ডায়াগনোসিস যখন বলবো, তো এপিলেপসি ঠিকই আছে, আপনি যেভাবে বলছেন, দেয়ার ইজ একটি ফোকাস ইন দ্য ব্রেন দ্যাট সেন্ডিং দ্য uncontrollable electrical impulse to the rest of the body, and that's causing uncontrollable shakiness of your body parts. So people with this condition may have unpredictable, uncontrollable jerky movements of the body. There might be some frothy discharge from the mouth and uncontrollable water work. Sometimes you may lose consciousness. So are you getting me? So actually, in most of the case, the cause is unknown. Sometimes it may be familial, but sometimes this condition may be precipitated by ওই condition গুলো একটু বললেন, হ্যাঁ, যেমন strong flashes of light, loud noise during period of stress, হ্যাঁ, if there was lack of sleep, so this condition may precipitate. So are you getting
Yeah.
me?
জি।
আচ্ছা, so we'll form a multidisciplinary team যেভাবে বলছেন. So is it curable? So I appreciate your concern. Actually, it is in most of the case, the person who are suffering from epilepsy, they need to continue the medication for lifelong. But if your conditions are well controlled and the medication may be stopped, but it can be controllable if you completely compliant with the medication, if you follow some safety measures, and then you may দিস কন্ডিশন ক্যান বি কন্ট্রোল। ঠিক আছে, আচ্ছা ওই ইয়েগুলো যে যেভাবে বলছেন এখানে সেফটি মেজার্স আমরা যেটা বলবো এখানে ফিমেল দিয়েই দিবে। হ্যাঁ, এপিলেপসি দেখবেন যে কারণ ফিমেলের অনেকগুলো সেফটি নেটিং আছে, যেমন পেশেন্ট জিজ্ঞেস করতে হবে আর ইউ ম্যারিড, so may I ask you some personal question? এখানে কিন্তু আপনার কোশ্চেন অ্যালাউড। হ্যাঁ,
হুম।
এই সিনারিটার ক্ষেত্রে, so may I know that are you married, do you have kids, or are you planning for pregnancy, or are you taking any birth control pill? So this is birth control pill ne? So okay, actually this the medication using for this condition will reduce the efficacy of the birth control pill. So we will contact with your woman doctor. She will give you another form of contraception, and you need to use double barrier method. Okay. Acha, so are you planning for pregnancy? Your pregnancy should be planned, and we'll form a multidisciplinary team involving the women doctor and the nerve doctor to give you the best care throughout your pregnancy period, because this condition will affect your unborn child, and some medications are not safe during your pregnancy period. So the women doctor will review your medication which are safe in pregnancy. এটা একটা। আর সেফটি রেটিং গুলো যে আপনি যেভাবে যেটা বলছেন যে you are strongly advised not to go for swim alone, or you need to avoid swimming. If you go for swimming, you need to carry someone with you. You are advised to have a to have shower rather than shallow bath. You are advised not to go near the fire alone, avoid sharp objects, and avoid heights. ওকে, আর ড্রাইভিং এখানে স্টপ করবে। এখানে ড্রাইভিং নিয়ে যদি বেশি কিছু বলে, এটা আপনি বলবেন যে ডিভি উইল গাইড ইউ ফার্দার, দে আর দ্য দে আর ইন এ বেটার পজিশন টু গাইড ইউ। আচ্ছা, এখানে যদি ধরেন টাইপ 1 ড্রাইভার হয় এবং যদি ফার্স্ট সিজার, হ্যাঁ ফার্স্ট সিজারের ক্ষেত্রে, এবং যদি পেশেন্টের লস অফ কনসিয়াসনেস হয়, তাহলে ড্রাইভিং স্টপ করবে ফর 1 ইয়ার। ঠিক আছে, এখন যদি টাইপ 2 ড্রাইভার হয়, যদি পাবলিক ভেহিকল চালায়, যদি একটা সিজার হয়, তাহলে ড্রাইভিং আপনার স্টপ করবে হচ্ছে 5 ইয়ার্স। মানে পেশেন্ট ক্যান রিঅ্যাপ্লাই ফর ড্রাইভিং লাইসেন্স ইফ he hasn't seizure I mean he hasn't seizure free for 5 years and have not take anti-epileptic drug for 5 years. মানে 5 বছর তার সিজার ফ্রি থাকতে হবে এবং অ্যান্টি মেডিকেশন ছাড়া আর কি। আর যদি মোর দেন 1 সিজার হয় টাইপ 2 ড্রাইভার, তখন সে রিঅ্যাপ্লাই করতে পারবে কখন? পেশেন্ট সিজার ফ্রি থাকতে থাকতে হবে ফর 10 ইয়ার্স। তখন সে পাবে ড্রাইভিং মানে লাইসেন্স পাবে আর কি, রিঅ্যাপ্লাই করতে পারবে। বাট এটা আপনি জানার জন্য জেনে রাখবেন, মেইন পরীক্ষা দেখা যায় এপিলেপসি আসলে এই ড্রাইভিং নিয়ে আপনাকে বারবার পেঁচাতে থাকে যেন আপনি একটা স্পেসিফিক কিছু বলেন, কিন্তু বারবারই আপনি হচ্ছে 2 থেকে 3বারই আপনি বলবেন যে ডিভিএল উইল বি ইন বেটার পজিশন টু গাইড ইউ ফার্দার। ওখানে কোনো অ্যাপ্রক্স মানে ডেফিনেট কোনো টাইম পিরিয়ড বলবেন না, অ্যাপ্রক্সিমেট একটা ইয়ে দিবেন, কাপল অফ ইয়ার্স, হ্যাঁ, বা কাপল অফ মান্থস, এটা বলবেন আর কি। ঠিক আছে, ভালো হয়েছে। আচ্ছা, আমি সেকেন্ড সিনারিওটা দিচ্ছি, কে পারফর্ম করবেন?
আমি করবো।
আচ্ছা ঠিক আছে, আমি আচ্ছা আমি গ্রুপেও দিচ্ছি সিনারিওটা। হুম, হ্যাঁ আমি তাহলে 3 মিনিট দিচ্ছি আপনাকে প্রিপারেশনের জন্য। ওকে।
Oh, can I ask you this question? How social worker can help when the surrogates say that I don't have anyone to drive my child to school?
তারা ওই যে আপনার হয়তো ট্রান্সপোর্টের ইয়ে করবে, ব্যবস্থা করে দিবে। সো এখানে
Okay.
হ্যাঁ, সো এও বলতেছিল না যে ওর হচ্ছে আই মিন সো ক্যান ইউ provide some social services so that they can help me to drive my children to the school.
I mean, are there any services like that?
নো, আপনি সোশ্যাল সার্ভিসের কথাই বলবেন। তারাই এগুলা ইয়ে করে, ট্রান্সপোর্টেশনের ব্যবস্থা করে if the person or the patient need it.
Um, can I just like ask them to contact the school if they are any transport in the school they can avail?
It's no, it's not necessary. I mean, to contact with the school. Rather, you should I mean, you should solve the problem.
Okay, আপু।
Okay. May we start?
Okay, okay. Okay, আপু, we can start.
Okay, let me hold the timer. Wait a bit. So, okay, your time has started.
Okay. Hi, I'm Dr. Mohammed, I'm the doctor in this clinic today. I'm here to discuss about your health condition. Is it okay for you?
Okay, doctor.
Can I confirm you are Mrs. Shirin, 38 years old?
Yes, doctor, I am Mrs. Shirin, 38 years of age.
Okay. May I know how far you know about your current health condition?
Doctor, actually, you might aware that I am known to have rheumatoid arthritis, and previously I was prescribed some medication called methotrexate with some vitamins called folic acid and calcium. Previously, my joint pain was controlled, but actually, doctor, I lost to follow up and discontinued the treatment because my husband died 5 years back, and I'm a mother of two children. I had to take care of my child. I remain so busy, but doctor, for the last 1 month, my joint pain has increased, and I have tried several medication like some painkiller, paracetamol, and steroid to reduce my pain. But doctor, all the medication didn't help me. So I consult my GP. My GP referred me to your clinic. You have done several investigation, and your consultant has reviewed my condition, and he decided to start a special medication which will be given through injection. So before starting this medication, you have done some test. So today I came to know the test result, doctor.
Yeah, I can see you have been going through very difficult times. I'm so sorry for that. Actually, the result of this report is not as we expected. Have you any expectation about the report?
Oh my God, doctor. Actually, what the test result is showing. Because I mean, do I have another condition? Because I'm having intolerable joint pain for the last couple of days, doctor.
I'm so sorry for that. The result is showing that you have developed a condition called latent tuberculosis. Have you ever heard this?
No, doctor. What is it?
Mm, uh, Actually, this is a condition when our body is getting affected by a superbug. And
Mm-hmm.
this superbug can affect the lungs, and other parts also, glands, even joints, sometimes tummy. It can affect many parts of our body, and this is very important to start treatment for this.
So, what is the name of the superbug, doctor?
It's tuberculosis.
Oh my God, doctors, do I have tuberculosis? But doctor, I know that doctor, people who are having tuberculosis, they are having some symptoms like fever, night sweat, and cough, and coughing out of phlegm, weight loss. But doctor, I don't have any of these symptoms. So how can I have tuberculosis, doctor?
Okay, let me explain to you. For your case, this is called latent tuberculosis. That means the bug is in latent or sleeping mode, so that you are not getting any symptoms. That doesn't mean that you doesn't. We already confirmed by this test that you have this, and we have a plan for you.
Okay, so doctor, what are you planning now?
We are planning to start treatment for your tuberculosis first.
But what about the injection? Because I am having severe joint pain. Your consultant was supposed to start the injection. So
Okay,
please start the injection because I have read in the internet that this injection are really beneficial and will reduce my symptoms.
I appreciate your knowledge. Yes, these injections are very good for controlling of your joint symptoms. But the thing is that, may I explain how these injections works for you?
Yes, doctor.
Okay, these are biological agents. When we usually give by injectable form, and they works by weakening your immune system. So
Mm-hmm.
the problem is that if we weakens your immune system right at this moment, the superbug can be in active form from the current sleeping mode, so that it can affect your lungs very seriously. It can cause destruction and damage of cells. It can runs to other parts of the body. So that would be a very serious condition for you. So for that, that's why we have a plan to delay the treatment for your joint pain. That doesn't mean we will let you leave you alone. We will give some very good painkiller right at this moment to relieve your symptoms. But we are going to start the treatment for your tuberculosis, and we have. Can I, if you want to know, I will tell you how we are going to treat.
Yes, doctor, you can proceed.
Okay. We have two regime for this treatment. One is you have to take one tablet that is for 6 months long. I'm so sorry for that. This is a long-term treatment. Another one is we have one tablet for 6 months, and another one is two tablet for 2 months, 3 months duration.
Okay.
Are you okay?
Yes, doctor. What about my joint pain, doctor? Because, doctor, I work as a typewriter and my joints are getting deformed day by day, and I'm having severe joint pain, doctor. I mean,
Yeah,
I don't have any signs, symptoms of tuberculosis. I can understand that this superbug will active if you don't treat this condition. But please reduce my pain first.
yeah, that's why as I have mentioned earlier, we are going to give a very good painkiller. Even even with after talking with your joint consultant, we may start some other medicine for your health. Are you okay with me?
Yes, doctor.
Yeah.
So, doctor, I have heard that this superbug, I mean, it's a very, as it's a superbug, and there is a chance of spread of infection to others. So, doctor, will spread this bug to others?
Actually, as because this is in latent form for your case, there is no need of any to keep to
봐.
stay inside room
한번 가만히 계세요.
for you. But if it goes to active stage, in that case, we need to keep you inside room.
Okay, doctor.
Okay. Do you have any other concern?
No, no, doctor. So, do I need to follow some special precaution?
Yeah, actually, the thing is that um, you should wear protective mask, gloves, and if anyone visit to you, should wear gown, special gown, and
2 minutes remaining.
wash. Can I ask you, are you smoking?
Yes, doctor, I smoke. I smoke 5 cigarettes per day.
I see smoking also very much injurious to your health, and it also can affect the lungs badly. So I would recommend you to go for smoking cessation clinic. Have you ever tried this?
No, doctor, I'll try this.
Okay, I appreciate this. Are you drinking?
No, doctor.
Okay, okay. What are you are a typewriter, right?
Yes, doctor. Actually, it's very difficult to continue my job, doctor.
Mm, I see. You're that's why we are with with your uh, consultant.
একটা অনুষ্ঠান হচ্ছে ফেয়ারওয়েলের মতো আর কি।
It's
এটা কি দিছে একটা জামা পাঞ্জাবি।
আচ্ছা, আপনারা কি মিউট করে নেবেন এটা?
uh,
Okay, you can continue.
okay, okay. So you are you okay to start this medication for your tuberculosis, this back?
Oh, okay, doctor, I'll take it.
Okay, okay. Do you have any other concerns?
No courses. So, doctor, I want to know that I have heard that the actually TB medication has lots of side effects.
Yeah, yeah, of course. There are some side effects with these two medicine. You can get some pins and needles over your hands or legs, and there may be some color change of your urine, but that doesn't need to worry about this because that will be reversible effects. But the thing is that the benefit from these medicines you will get that is far more than the this symptoms. That's why we will recommend you to take
So,
this medicine.
doctor, will you start this biological injection later on?
Yeah, we will delay maybe one for you. After that, we will have a plan to start your biologic medicine.
Okay, okay, thank you. Your time is up. Okay, you did quite well. একটা জিনিস ভুল হয়েছে, এটা কি বলেন তো?
Uh, I'm not sure.
আচ্ছা, এখানে পেশেন্ট টাইপরাইটার, হ্যাঁ, এই জন্য অকুপেশনটা আমি বলতেছিলাম যে আমি টাইপরাইটার। সো রিউমাটয়েড আর্থ্রাইটিস ইজ এ প্রোগ্রেসিভ ডিফর্মিং ডিস্ট্রাকটিভ ডিজিজ। হ্যাঁ, পেশেন্ট বলতেছিল মাই জয়েন্টস আর গেটিং ডিফর্ম। সো এখানে ইফ ইফ শি কন্টিনিউ her job, then there will be overuse of her joints.
Okay,
There
okay,
will be
okay.
more chance of deformity. এখানে আমরা কোথায় পাঠাইতে হবে পেশেন্টকে তাহলে?
Health department.
হ্যাঁ, occupational health department এ পাঠাতে হবে। I'm very sorry to let you know this. If we continue to do this job, then your joint pain will be increased and your joints will deform day by day. Okay, I will refer to the occupational health department. They will give you another suitable job that doesn't involve the overuse of your joints.
Okay.
এটা আচ্ছা, এখানে আচ্ছা, এখানে আমাদের লেটেন্ট টিবি, হ্যাঁ, লেটেন্ট টিবিটা মানে হচ্ছে ইউ হ্যাভ দ্য সুপারবাগ ইনফেকশন কল টিউবারকুলোসিস। হ্যাঁ, আপনি কি নামটা বলতেছিলেন না? আচ্ছা, তো tuberculosis, but there are two types of tuberculosis. One is active form and another one is latent tuberculosis. Don't bother about this medical term. That means you are having this superbug inside your body, but you are not producing any sign symptoms because you have the good immunity. So in people who are having good immunity, this bug remain latent and does not produce any sign symptoms. I appreciate your knowledge that yes, the people who are having this super bug, they start to produce the symptoms that you have just mentioned. But in your case, the super bug is not active form. So এই যখন লেটেন্ট টিবি হয় তখন কিন্তু আমরা কোনো বায়োলজিস গুলো দিতে পারি না। সো এখানে আরেকটা জিনিস যে আমি বলতেছিলাম বারবার যে পেশেন্টের খুব জয়েন্ট পেন, হ্যাঁ, সো হাউ আর ইউ গোয়িং টু ট্রিট মাই জয়েন্ট পেন, এখানে আপনি বলবেন যে we will form a multidisciplinary team, including the joint doctor, physiotherapist, and occupational therapist. They will provide you another form of medication to reduce your joint pain and to dampen down the inflammations. So the joint doctor will talk to you later on in details, but right now, as you are having this superbug infection, we need to treat it fast. And people who are having this superbug, in that case the biologics is not appropriate because it যেটা বলছেন ওটা it will weaken your immunity, and there will be more chance of infection, and this superbug will get active and start to produce symptoms, and that will be difficult to treat, and you need to continue treatment for long time, for 6 months or 1 year, এটা যা বলছে সেটাই। আচ্ছা, সো এখানে এইটাই জবটা সুইচ করতে বলতে হয়তো, আদারওয়াইজ সবকিছুই ওকে। আর ওর আরেকটা কনসার্ন ছিল যে উইল ইউ স্টার্ট দিস বায়োলজিক্স ইনজেকশন লেটার অন। ওকে, অ্যাপ্রিশিয়েট ইউর কনসার্ন। ইয়েস, ইউ নিড টু ট্রিট দিস, at first we need to treat this superbug, and you will be retested later on. And if your symptoms are well controlled, and the consultant will review your condition, whether you may need this injection or not. We'll keep you updated time to time. ঠিক আছে?
Okay.
Okay, very good. আচ্ছা, থার্ড সিনারিওটা কি করবেন? কে করেন নাই? মোহাম্মদ মনোয়ার ভাইয়া, আপনি করেছেন?
আপু, আমি মোহাম্মদ মুনার।
ও
দেখুন,
আচ্ছা, আচ্ছা, সরি, আমি খেয়াল করি না, আপনি করেছেন, ঠিক আছে। তাহলে
আপু,
হুম।
এটা কি জাজমেন্টাল হয়েছে যে ক্যান্ডিডেট সার্ভারকে বলছে যে আপনাকে মাস্ক পরতে হবে, গ্লাভস পরতে হবে, কারোর
আচ্ছা,
সাথে দেখা করতে হলে?
ওকে ওকে ওকে, ভালো কথা মনে করছেন, আমি এটা ভুলে গেছিলাম ভাইয়া। লেটেন্ট টিবি হচ্ছে স্প্রেড করে না ইনফেকশন, এখানে কোনো আপনার অ্যাক্টিভ টিবির মতো আইসোলেশনের দরকার নাই, তারপর হচ্ছে মাস্ক, গ্লাভস, এই জিনিসগুলো দরকার নাই, ঠিক আছে। সো ও ও একটা, আমি একটা ইয়ে করছিলাম যে উইল আই স্প্রেড দিস বাগ টু আদার্স? নো, you cannot spread the TB infection to others if you have latent tuberculosis, as this bug is latent.
ওকে।
হুম, থ্যাংক ইউ এটা মনে করে দেওয়ার জন্য, আমি এটা ভুলে গেছি, এটা আমি নোট আউট করে রাখছিলাম যে বলবো। ঠিক আছে, সো মাহফুজ রহমান ভাই, আপনি করেন থার্ড সিনারিটা।
আপনি শুনতে পাচ্ছেন? মাঝে
হ্যাঁ হ্যাঁ,
আমাকে
শুনতে পাচ্ছি, এটা ইজি আছে, করেন। রিসেন্ট সিনারি করেন। আপনি সিট পেয়েছেন?
না বলছেন।
আচ্ছা, সমস্যা নেই, করেন। হ্যাঁ, আই এম গিভিং ইউ 3 minutes. Bhaiya, may we start?
Okay, okay. Hello, sir.
Wait. Okay, your time has started. Yes, doctor.
Hello, sir. I'm Dr. Rahman, not the doctor in this hospital here today. Are you Mr. Daniel?
Yes, doctor. I'm Mr. Daniel, 50 years of age.
Oh, okay, sir. Uh, Today I'm here to discuss about the health condition. Is it okay, sir?
Okay, doctor.
Okay. Okay, sir. Could you tell me how much do you know about the health condition?
Actually, doctor, for the last couple of months, I'm feeling very much tired. I feel lethargic, and I don't feel any energetic, doctor. And I have also noticed that, doctor, I'm gaining weight. I have gained at least 10 kg for the last 2 months, though it was unintentional. So I consulted with my GP, and GP did some investigation, and he found that I'm having low thyroid hormone level. And doctor, you might have heard that for the last 8 years, I'm known to have high blood pressure, high blood sugar, and I'm known to have a heart condition. My wife recently noticed that I snore at night, doctor, and I feel very drowsy throughout the day. So, with this complaint, I consulted my GP. GP referred me to your clinic, and you have done several investigations, a special test to check my sleep level. And today I came to know the test result, doctor. Actually, what the test result is showing.
Okay, Mr. Daniel, uh, you are suffers a lot, and we appreciate your feelings about your health status, and you are passing through tough days. But don't lose hope. We are with you. So, Mr. Daniel, we have you have symptoms, snoring at night, lethargy in day, all day time, and you have so with this complaint, our consultant doing some tests. You said it earlier. So all the test result report in our hand, and we reaches a diagnosis. Uh,
So, what is
but
it, doctor?
it's a uh, obstructive sleep apnea. Don't bother it. It's a medical term. I'm going to explain you.
Okay.
So it's a condition where our airway getting obstructed uh, by uh, getting some kind of obstruction. That's why you have a snoring. You don't get enough oxygen at night. That's why you get lethargic in the in all day long. Are you getting me, Mr. Daniel? I'm going to
Yes.
draw a picture that
Okay.
that will get more easier to get realize it. There is our windpipe, and there is some it getting obstructed when air passing through it. That's why you have symptoms of obstructive sleep apnea, and there is a lots of cause behind it. As you say, you have hypothyroidism, that your gland is producing less hormone. You have gaining weight, and you have uh, hypertension, diabetes,
So, doctor,
lots of.
is it a serious condition?
It's a yes. If don't treat it, and don't remove the complication there, it may getting serious, and there is a maybe lung failure developed, and it may endanger your life. But don't be fear, don't be panic. With appropriate treatment, you may lead a normal life. Are you getting me, Mr. Daniel?
Oh my God, it sounds horrible. I will get lung failure. So, doctor, I think that it's just a simple snoring because I have gained some weight. Not only me, doctor, many people snore at night. So, does it always means that I have some disease, doctor?
Yes. Uh, Sir, could you repeat what you say? I can't understand.
So doctor, I thought that it's just a simple snoring because many
Yes.
people snore at night, and I thought that because of my gaining weight, and does it always means that I have some disease due to snoring?
Snoring. Yes, I appreciate your knowledge, but at this time, this your snoring, it's due to some problem in your airway tract. It's really is a problem. Really,
But doctor,
it's a matter.
why do I feel tired throughout the day, doctor? Is it just because of low thyroid hormone level?
Low thyroid hormone level, yes, it could be, but there is a you don't get enough oxygen in your breathing, so that's why you have not get energetic and you feel fatigue all the time.
Okay, doctor.
So
So, doctor, how are you going to treat me, doctor?
okay, ma'am, don't worry. We have been making a multidisciplinary team. There will be a lung doctor. There will be a physiotherapist. There would be dietitian. There would be a specialist nurse and occupational health team. And we'll formulate a management plan. So, sir, can I ask, do you drive?
Yes, doctor, I drive.
Oh, so sir, as you get feeling dizzy or sorry, feeling lethargic or getting sleep, uh, uh, we advise you to stop your driving right at this moment and until further notification. Are you getting me,
Oh,
Mr. Daniel?
okay, doctor.
So, so, Mr. Daniel, do you drink? Do you drink?
Yes, doctor, occasionally in party.
Okay. Occasional party, but as drinking provoke this condition more and more, so we advise at this moment to cut down or it will be best to remove this kind of
Okay,
drinking.
2 minutes remaining. Okay, doctor. So, what about my
Okay.
weight, doctor? I have gained weight 10 kg over the last 2 months.
Okay, we will have a make a nutritionist appointment, a dietitian. He will give you appropriate advice about your food habit, and also you have some comorbidity like hypertension, diabetes, hypothyroidism. So these diseases should be addressed and this should be properly treated. And by doing this, you will have a ideal weight. Ma'am, do you
Okay.
have, sorry, sir, do you have any concern?
So, doctor, is it curable? I mean,
Is
it's
it,
hampering my personal life, doctor. My wife started to complain that I snore at night, and she can't sleep.
okay. Well, there is some remedies, there is some device, we call mandibular advancement device. With with using that, there will be some relief of snoring and your wife can be get rid of this. Uh, so that is an effective treatment. The snoring can be more likely it will be resolved. And following all the advice from the multidisciplinary team or a specialist team, you will make a little normal life.
Okay, doctor.
Okay, so sir, I will give you some leaflet brochure about the disease, so you may get more information. I will give our contact number that you can contact.
Okay, your time is up. Okay, you did well. আচ্ছা, এখানে অবস্ট্রাকটিভ স্লিপ অ্যাপনিয়াটা একটু সুন্দর করে এক্সপ্লেন করা যেত, হ্যাঁ। যে you have that your reports are at my hand and it showed something concerning. So what is it, doctor? The report showed that you have a condition in our medical term called obstructive sleep apnea syndrome. So have you heard about this before? No, doctor, what is it? So actually it is a condition as you have gained weight. So when you go for sleep, the muscle around your airway and throats relax and it narrows the airway. So there is difficulty in breathing in oxygen and breathing out the toxic gas called carbon dioxide. So the toxic gas start to build up inside your body, and that's causing disturbance of your sleep pattern. There is sudden stoppage of breathing for a while that is noticed by the bed partner. So due to repeated sleep interruption during night, you started to snore at night, and that is why you feel tired throughout the day, Mr. Daniel. So do you get me? Yes, doctor. So এখানে আমি বলছিলাম যে actually I thought that it's just a simple snoring. যে not only me, doctor, many people snore at night. Does it always mean that I have some disease? Okay, I appreciate your knowledge. Yes, you're right that many people snore at night, but in your case you have a diagnosis called this. আচ্ছা, তো এখানে আপনি ইয়েগুলো এখানে মেইন হচ্ছে ডিজিজ ডায়াগনোসিস আর ফার্দার প্ল্যান অফ ম্যানেজমেন্ট বলা। এখানে মেইন যে মেইন ম্যানেজমেন্ট কি ওয়েট লস, তাই না? এটা কিন্তু আপনাকে স্পেসিফিকলি বলতে হবে রোগীকে যে will form a multidisciplinary team involving the sleep doctor, involving the will also involve the dietitian, but the main form of treatment is weight loss. You need to try to lose your weight. We will involve the dietitian. He will formulate a better dietary plan for you. You need to try some exercise and will enroll you in exercise training program that will help to reduce your weight. And you need to stick to your thyroid medication. And there are some other forms of treatment. You will be given pressured oxygen through a face mask. There will be a small device which will be kept by your bedside. There will be two tubes. One tube will be tube will be attached to the machine, and another tube will be attached with the face mask. And you will be given oxygen at a specific rate throughout the night to keep the airway open, so that you will have better sleep and it will prevent your airway closing while you sleep. It will help to reduce your symptoms like snoring, and reduce your symptoms like it will reduce your tiredness and reduce the complication of this condition. আচ্ছা, এটা কি আমি বলছিলাম? সো ডক্টর, ইজ ইট সিরিয়াস কন্ডিশন? মেন্ডিবুলার অ্যাডভান্স ডিভাইসমেন্টটা কিন্তু মানে সেটা কিন্তু ইউজ করা হয় না, বাট সিপেপ কিন্তু আপনার ইউজ করা হয়। সিপেপ এর কথাটা আপনি যদি মানে এখানে আপনাকে সিপেপ এর কথাটা বলতে হবে এই কারণে, কারণ এখানে বলেই দিছে ডিসকাস অ্যাবাউট এ ডায়াগনোসিস এন্ড ফার্দার ম্যানেজমেন্ট প্ল্যান। সো ফার্দার ম্যানেজমেন্ট প্ল্যান, আপনি ওয়েট লস কিভাবে করবেন, তারপর সিপেপ এর কথা, তারপর কিছু কিছু ক্ষেত্রে সার্জারিও লাগে। এই জিনিসগুলো বলতে হবে। আর এটা বলছিলাম যে সো ডক্টর, ইজ ইট সিরিয়াস কন্ডিশন? Well, I appreciate your concern, Mr. Daniel. I can understand that you're really anxious at this point. Actually, yes, it can be serious if it remains uncontrolled. If it is untreated, then it can cause some problem, like it will there is poor performance at work, and there is increased chance of blood pressure, increased chance of stroke and heart attack. I'm very sorry to let you know this, but you can avoid all the complications if you follow the advice that we will give it to you. এখানে আপনি ড্রাইভিং স্টপ করছেন, ভেরি গুড, বাট এখানে সিপেপের কথাটা একটু বললেন, ঠিক আছে? আর এখানে অ্যালকোহল স্টপ করতে হবে না। অ্যালকোহল, ইউ নিড টু কাট ডাউন ইউর অ্যালকোহল ইনটেক, যদি এটা রিকমেন্ডেশন লিমিটের উপরে থাকে, ঠিক আছে? আর আরেকটা জিনিস বলে দিতে হবে যে ইউ আর অ্যাডভাইস নট টু ইউজ এনি স্লিপিং পিল, মানে সিডিটিভ কিন্তু এখানে ইউজ করা যাবে না। এই জিনিসগুলো একটু বলে দিতে হবে। আচ্ছা, লাস্ট সিনারি কি করবেন?
স্টোরিং যে ভালো হবে কিনা, ওয়াইফ পার্টনার যে বললো, ওটা কি আসলে ভালো হয়?
ওর যদি ওয়েট রিডাকশন হয় তখন তখন তো এই জিনিসগুলো সিমটমস গুলো কমে যায় সিপেপ ইউজ করলে। Well, I can understand that. I mean, these conditions is hampering your personal life. We can really understand, but don't worry, we are here by your side. Our multidisciplinary team will formulate a better management plan for you. As I have already told you, that there will be a device through which the oxygen will be given through the face mask, which will keep the airways open, and it will reduce your symptoms like your snoring and the fatigue. এগুলো আচ্ছা। সো লাস্ট সিনারিটা কি করতে চাচ্ছেন? একজন করেন নাই না? আহমেদ ভাইয়া কি করেছেন? আচ্ছা, কারো তো কোনো কোয়েশ্চেন নাই সিনারিটা নিয়ে?
আপু একটা কোয়েশ্চেন আছে।
আচ্ছা, হ্যাঁ।
আপু যদি জিজ্ঞেস করে যে আমার কি should I have to take this CPAP for lifelong?
Acha, acha. Okay, I appreciate your concern. Actually, right at this point, it is tough for me to comment on this how the situation will turn around in the coming days. But you will be given. You need to use this device for a long time. But if your symptoms are well controlled and if you gradually lose your weight, the symptoms will go away. And at that time, you need to use this device for a lifelong. কারণ যার ধরেন এটা আমার কেন হচ্ছে, হ্যাঁ, পেশেন্টের ওয়েট গেইন করতেছে, সো আমাদের যে এয়ারওয়েজ বা ঠোঁটের অ্যারাউন্ডে যে সফট টিস্যু গুলো আছে সেগুলো তো সোয়েলেন হয়। এই কারণেই সে যখন মানে when he
I
go
mean,
for
যদি ওজন কমাইলে আর লাইফস্টাইল মডিফাই করলে তারপর
করলে
ইমপ্রুভমেন্ট
সিমটমস
হয়,
কন্ট্রোল হবে এবং
কি
সেটা
করতে হবে আর কি। I mean,
এই জিনিসগুলো বলতে হবে আর কি, তার লাইফ লং তো তখন একটা দরকার হবে।
ওকে
ঠিক
ওকে।
আছে। আচ্ছা, লাস্ট সিনাইট একজন করেন।
আপু এটা কোন ডায়েটে আসছে, মানে কোথায় আসছে সিনারিও?
আচ্ছা, এটা আমি রিসেন্ট থেকে মানে রিসেন্ট সিনারি গুলো থেকে নিয়েছে, মানে রিসেন্ট ডায়েটের সিনারি গুলো থেকে করছি, মেক করা। বাট এটা কোথায় আসছে আমার আসলে সঠিক মনে নাই, বাট এটা রিসেন্ট সিনারি। আপনার রিসেন্ট সিনারি গুলো দেখতেছেন না?
কোথা থেকে দেখবো তাই তো বুঝতেছি না।
আচ্ছা, আমি একটা একটা ফাইল শেয়ার করবো না, ওখানে রিসেন্ট সিনারি গুলো পিডিএফটা একসাথে করে দেওয়া আছে, ঠিক আছে?
জি 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 আপু, জি জি,
আমি এটা
থ্যাংক ইউ।
গ্রুপে দিয়ে দিব। ওকে। আচ্ছা, লাস্ট সিনারিটা কি একজন করেন? আচ্ছা, ডক্টর খান ভাই আপনি করেন, কেউ না করতে চান?
হ্যাঁ হ্যাঁ, আমি
আপনাকে দিচ্ছি।
করতে পারি দেন।
ঠিক আছে, আমি গ্রুপে দিচ্ছি আর শেয়ার করছি।
আপু ওই লাস্টে যতগুলো সিনারিও বের হয়েছে বিভিন্ন কেন্দ্রগুলোতে, ওটা যদি পিডিএফ আপনার কাছে থাকে একটু শেয়ার করেন কাইন্ডলি।
হ্যাঁ
হ্যাঁ,
হ্যাঁ, আমি এই যে ক্লাসের পর শেয়ার করে দিব। ওকে।
ওকে, থ্যাংক ইউ।
হ্যাঁ, থ্যাংক ইউ। আচ্ছা, সিনেটে গ্রুপে দিচ্ছে, এখানে শেয়ার করছি।
আসছে, সিনারিও আসছে। See you.
সৌজ ভাই, আপনার সিট কোথায় পড়ছে?
ভাই পুনে,
পরীক্ষা কবে ভাই?
5 তারিখ এপ্রিল। হ্যাঁ, আপু শুরু করি। হ্যালো।
ওকে ভাই, আই ক্যান স্টার্ট নাও। হ্যালো ডক্টর।
Hello, I'm Dr. Khan, one of the doctor of this clinic today, and I'm going to talk about Mrs. Rashida, 59 years old, about her health condition. And for the confirmation, are you Mrs. Meena, the daughter of the Mrs. Rashida?
Yes, doctor, I am Mrs. Meena, daughter of Mrs. Rashida, 59 years of age.
Okay. Are you the next of kin of Miss Rashida?
Yes, doctor, I'm the next of kin.
Okay, we are going to discuss about your mother's health condition. So before entering the detail, may I know how much you know about your mother's health condition?
Doctor, actually, last night my mother has been suffering from severe chest pain and shortness of breath. Actually, this was the first time in her life she has been suffering from. So, with this complaint, I brought my mother to your hospital. You have done several investigations, some blood tests. You have done electric testing of her heart and jelly scan of her heart. Actually, today I came to know about the test result, and I want to know about my mother's health condition, doctor.
Okay, I must appreciate your concern. Yes, she is under our supervision. And after doing all the tests, it is proved that the test result is concerning for us.
Oh my
Are you
God,
with me?
doctor. I mean, what the test result is showing, and how is my mother now?
Okay, I must appreciate your concern. Yeah, your mother suffering from a massive heart attack, also the cardiogenic shock. Don't bother about the medical term. It occurs due to some blockage of the important blood channel of the heart, and that's why she underwent this shock. Are you with me?
Oh my God, doctor, what are you telling? Heart attack. So, doctor,
Yes.
what is cardiogenic shock?
Okay, okay, all right. Let me explain. Due to this heart attack or blockage of the blood channel, the major portion and important portion of the heart stop beating. That's why the blood cannot pump out from the heart to the different important organ of the brain or organ of the body. Most importantly, the brain and the oxygen doesn't carry out to the brain. That's why her blood pressure goes down. And for that, our teaching team sincerely started some medication for this. But she's not responding. I'm sorry to say. Are you with me?
Oh my God. So, doctor, what are you planning now? Do something and transfer her to the ICU.
Okay, Mrs. Mina. I must appreciate your concern, and yeah, your mother health is very precious for you, and as well as for us. And I can feel the situation, and I feel very sorry for this condition. And one thing I want to discuss with you that your mother condition is very critical. Our uh, uh, our multidisciplinary team uh, assessed her very carefully, and they found that the condition is very critical. Are you with me?
Yes, doctor, I'm with you. So, doctor, do something.
Okay. And our teaching team thinks that her condition too critical that the resuscitation may worsen the condition and it will not help her. Are you with me?
What are you telling, doctor? Why, doctor? Why have you taken
Okay.
this decision? And you are going to
Okay.
let her die, doctor, just because of she's an old person?
I'm sorry. I'm very sorry. And no, we are not taking the decision for her age. I'm sorry to tell you that it's no. In the normal, usually, if the heart stops, we are giving some compression of the chest and some medication through the blood and also oxygen through a pipe in throat. But in your mother's condition, it will not be helpful because the heart attack is so severe that the condition may not reverse. But in the course of time, if your mother shows any feature of improvement, our decision may alter. So we will assess her time to time. But right now, our decision is not to resuscitate her. Are you with me?
Yes, doctor, I'm with you. So, doctor, what are you planning now? How will you treat her if you don't give resuscitation?
Okay, okay, all right. And regarding the resuscitation, I want to tell you more about it. Sometimes there are some very bad effect of the resuscitation. The ribs or bone of the chest may be broken, the bleed inside, and it is not dignified to give the resuscitation in this situation. So it will bring more harm to your mother and this power. It add more more harm to your mother and adding more discomfort along with it. And our treating team started the device that helps the cardiac pumping, but it's not responding right now. For that, our treating team decided to give her the supporting treatment like oxygen, the fluids, and if she needs any calming medication, or if she feel pain, the painkiller. Are you with me?
Yes, doctor, I'm with you,
Hello.
doctor. But, doctor, my mother expressed her thoughts before to do everything for her to be alive, doctor.
Okay, okay, all right. So we
2 minutes
respect
remaining.
her. Thank you. We respect her decision. So she has advanced directive, right? Hello.
No, doctor, there is no advance directive.
Okay, all right. Are you the lasting power of attorney from her?
Yes, doctor, I'm the lasting power of attorney.
Okay, okay, all right. In this situation, we will continue the supportive treatment for your mother. Is it okay for you?
Okay, doctor, but doctor, I have told you that my mother expressed her thought before to do everything for her to keep her alive, doctor. Please give CPR
Okay.
and do
For the best
everything to keep
interest,
my mother alive.
yeah. We must respect her decision, but our treating team decided that for this condition, not giving the resuscitation is the best option for your mother, and it is the best option right now. It is not dignified to give her CPR right now, and it will not be helpful at all. This is the decision of our treating team. Are you with me?
Yes, doctor, I'm with you, doctor.
Okay, do you have any other concern?
No concern.
Okay. Do you need any other support? Or may I help you in any other way?
No, doctor, thank you. Just please do everything for my mother to keep her alive because I love my mother very much.
I want to assure that we are here with your mother, and the treatment that's permitted in this condition, we are very sincere to give this treatment. Are you with me?
Yes, doctor, I'm with you.
Okay, thank you.
Okay, your time is up.
শেষের দিকে কি বলতে হবে ভুলে যাচ্ছিলাম।
আচ্ছা, ওকে, ভালোই হয়েছে। আমি জাস্ট কিছু জিনিস অ্যাড করে দিই, হ্যাঁ? ডিএনএ সিপিআর। আচ্ছা, তো এখানে আচ্ছা আপনারা ডায়াগনোসিসের ক্ষেত্রে বলার ক্ষেত্রে আমি ফার্স্টে আপনি মেডিকেল টার্মটা বলে নিয়ে তারপরে এক্সপ্লেইন করেন, হ্যাঁ? আচ্ছা, তো the test results are at my hand. I'm very sorry to let you know this. Actually, Miss Meena, the test results showed very serious. So what is it, doctor? The test results showed that actually she has developed massive heart attack, which is called in your medical term massive anterior MI. I'm very sorry to let you know this. এটা বলে একটু pause দিবেন, হ্যাঁ? So, do you have any idea about it? So, no, doctor. Actually, it is a condition in which there is blockage of a major blood channel supplying the heart. So the heart cannot pump enough amount of blood to the rest of the body. For this reason, her blood pressure has dropped and she has developed another condition called cardiogenic shock in our medical term. Actually, it is a very serious condition, and our consultant has reviewed your mother's health condition, and we have started a special medication, which is she is receiving through injection called dobutamine, which will increase the force of contraction of the heart so that the pumping capacity of the heart increases and the blood pressure improves. And it will also improve the blood flow to the other organ. But Miss Meena, I'm very sorry to let you know this. Unfortunately, she is not responding with this medication. And তখন বলতে হবে, so doctor, what are you, so তার concern যে, so how are you going to treat her next? Actually, her condition is quite critical, and consultant has reviewed your mother's health condition, and we came up with a decision. Would you like to hear? I can understand that what situation you are going through, Miss Meena. But don't worry, we are here by your mother's side. We will do everything possible for your mother to keep her comfort. So our consultant had decided that if her condition worsen, we will not follow any aggressive form of treatment like resuscitation, called in our medical term CPR, cardiopulmonary resuscitation. Do you have any idea about what the resuscitation is? No, doctor, what is it? So when someone's heart stops beating, we will start resuscitation to stimulate the heart to beat again. We will do resuscitation in the form of by giving repeated chest compression, by putting tube through the airways, by giving emergency medication through injection to stimulate the heart to beat again. But in your mother's case, her condition is quite delicate, and we will not follow this aggressive form of treatment because considering the risk versus benefit ratio, এই টার্মগুলো আসতে হবে, হ্যাঁ, considering the risk versus benefit ratios, the risks are way more. তখন আমার ছিল, so why doctor, why have you taken this decision? You are going to let her die as she is an old person. আচ্ছা, এই ধরনের ইমোশনাল ইয়েগুলার কনসার্ন গুলার অ্যান্সার এভাবে দিতে পারেন যে, মিস মিনা, we feel sorry that you feel in this way. Please don't feel in this way because we are trying everything. We are trying everything to treat your mother, to keep her comfortable. Actually, this decision has taken in your mother's best interest, because there are several complications if she receives chest compression, like there will be breakage of chest bone, there will be some bleeding inside her lung, and there will be some damage or injury to the airways. It will hamper her dignity, and it will add her sufferings to her sufferings. And in your mother's case, if she received resuscitation, there will be more side effect, and in majority of the people who receive CPR, the procedure is unsuccessful. Doesn't give CPR, not giving CPR doesn't mean that we are letting her die. Rather, she is receiving supportive treatment. She will maintain her nutrition through the blood chain, and will give her oxygen, will give her other supportive measure. তখন সে আবার একটু বলবে যে, তখন আমি বলছি, my mother expressed her thoughts before to do everything for her to keep her alive. Okay, তখন বলবেন যে, I appreciate your mother's thought. I can understand that you want to do everything for your mother. Please be sure that the decision has taken in your mother's best interest. Actually, giving resuscitation, it is a treating team decision. If her condition improves, if her condition improves, or if she shows the signs symptoms of improvement, this is not a final decision. The decision can be reviewed. And her condition is so delicate that even if it is successful, her days or the days will be the days of suffering rather than the days of quality. And in this critical situation, we always try to maintain the patient's dignity. We don't want to hamper her dignity. We don't want to do anything harmful to her. So are you getting me, Miss Meena? এভাবে বলতে পারেন, ঠিক আছে? আদারে সব
জি
ঠিক ছিল
জি
এখানে অ্যাডভান্স ডাইরেক্টিভ আপনি ডিরেক্টলি অ্যাডভান্স ডাইরেক্টিভ না বলে এভাবে বলতে পারেন সো মে আই আস্ক ইউ সাম পার্সোনাল কোশ্চেনস okay so has is there any written document that how your mother would like to be treated in this critical situation or has she appointed someone to take decision on her behalf
আচ্ছা জি এখানে তো এই দুইটা প্রশ্ন ছাড়া আর কোনো প্রশ্ন নাই তাই না
না প্রশ্নে
পার্সোনাল
আর আর আপনি সোশ্যাল হিস্ট্রিটা নেবেন সো এখানে বলতে পারেন সো মে আই নো দ্যাট whom do your mother live with do you need any kind of support right at this point মানে আরো আরো সিম্প্যাথেটিক এমপ্যাথেটিক হবে না আর কি ঠিক আছে কারণ ডিএনএ সিপিআর ডিসিশন এটা মানে এই সিনারিও গুলোতে ওরা দেখবে যে মানে হাউ সিম্প্যাথেটিক্যালি অর এমপ্যাথেটিক্যালি ইউ আর অ্যানসারিং দ্য কনসার্ন অফ দ্য সারোগেট ঠিক আছে আচ্ছা কারো কোনো কোশ্চেন আছে সব ধরনের ডিএনএ সিপিআর এভাবেই করবে ঠিক আছে এই একই প্রফরমাতে মানে মোরলেস এই কনসার্ন গুলাই ওরা করবে
আচ্ছা আপু এখানে কি
হ্যাঁ
এটা বলতে হবে যে CPR to be successful CPR we need the major organ to be in good situation like for your mother case the heart and muscle is already damaged এরকম কিছু
না না এরকম কিছু না আপনি কারণ ইন মোস্ট অফ দ্য কেসেস সিপিআর ইজ আনসাকসেসফুল সো নট গিভিং সিপিআর ডাজন্ট মিন দ্যাট উই আর নট ডুইং এনিথিং ফর হার ওই কথাগুলো না হ্যাঁ সিপিআরটা দিব না তার কন্ডিশন ইজ কোয়াইট ডেলিকেট এন্ড ইট উইল কজ মাচ মোর হার্ম কনসিডারিং দ্য রিস্ক ভার্সেস বেনিফিট রেশিওস দ্য রিস্ক আর ওয়ে মোর দিলে কি হবে ওই যে ওই কমপ্লিকেশন গুলো বলবেন এন্ড ইট উইল হ্যাম্পার হার ডিগনিটি ইভেন ইফ ইট ইজ সাকসেসফুল it will be the days of sufferings rather than the days of quality. I hope that you don't want that. We also don't want that.
ওকে
আচ্ছা আচ্ছা কারো কোনো কোশ্চেন আছে
ও একটু অ্যাড করি
হ্যাঁ
যেটা হচ্ছে
হ্যাঁ
ভাইয়া যে রিসাসিটেশন বারবার বলতেছিলেন আর কি আমার মনে হয়েছে যে এটা মানে একটা জার্গন সো ওভাবে বারবার না বলাই বেটার আর কি যে
আচ্ছা
রিসাসিটেশন so মানে better to like mention it once what is DNR and then like explain it from there to what is it is actually that we are
না
not
না
restarting her heart.
সিপিআর ইজ আপনি জার্গন বলতে পারেন বাট রিসাসিটেশন ইজ নট এ জার্গন সো আপনি যখন ডিএনএ সিপিআর মানে এক্সপ্লেইন
Resuscitation is not a jargon.
নো ইটস নট এ জার্গন রিসাসিটেশন বরং সিপিআর বারবার যদি বলেন সেটা আপনাকে একটু জার্গনের মতো শোনাবে দ্যাটস ওয়াই রিসাসিটেশন মানে সিপিআর কি কার্ডিওপালমোনারি রিসাসিটেশন সো আমরা এখানে মানে
Oh, I thought like
না না এটা
maybe my mistake, it's a jargon. I thought, okay, sorry.
it's not a jargon
Another thing that I felt like সবুজ ভাই has more inclined আমিও এটা ভাবছিলাম আর কি has more inclined to like doing it an end of life care scenario. So he was mentioning about this nutrition, like of this coming medication and everything. So I thought, there's no clear indication in the scenario that this is an end of life care scenario. So
no
maybe
it's
not go
not
there.
yes it's not end of life care end of life care একদম স্পেসিফিকলি মেনশনই করে দিবে যে I mean he will not survive or he is passing in the last days or last hour of her life এভাবে বলেই দিবে হ্যাঁ সো রিসার্চ আমি যেটা বলতে চাচ্ছি যে ডিএনএ সিপিআর এই টার্মটা আপনি কিভাবে স্টার্ট করবেন হ্যাঁ এটা বলবেন যে our consultant has reviewed your mother's health condition her condition is quite critical so we came up with a management plan if her condition worsen we will not follow any aggressive form of treatment like resuscitation, called in our medical term CPR, cardiopulmonary resuscitation. So, do you have any idea what is resuscitation? ঠিক আছে এইটা বলে
Yeah,
তারপর
so it means that it's a medical term and we're explaining it to the patient. That's what I thought.
no rather আপনি ডিএনএ সিপিআর বারবার বলতেছেন এটা আপনার jargon. The resuscitation is not a jargon.
Oh, okay. Thank you, Apu.
ওকে থ্যাংক ইউ আচ্ছা আপনাদের কি মানে ক্লাস নিয়ে কোনো ইয়ে আছে সাজেশন আছে যে ক্লাস এভাবে হলে ভালো হয় বা মানে এনি সাজেশন যেটা নেক্সট ক্লাস থেকে হেল্পফুল হতে পারে
আপু একটু মেডিকো লিগ্যাল অ্যাসপেক্ট গুলা মানে
হুম হুম
বললে ভালো হয় আমার মনে হয় যে লাইক in what scenarios we are like will be মানে discussing about what medico legal aspects behind, like, whatever sentence or, like, whatever things we say, right?
আচ্ছা, হ্যাঁ,
It has some purpose, right? So maybe, not merely like we'll just utter some or memorize some words and, go into the station. Most of the times what happens, I believe, in stations, we learn something, right? We memorize something, and go into the station, the surrogates say something different to us, right?
yes.
So
So
we
okay, I
then
got your
face
point.
difficulty facing it,
I got your point.
addressing those concerns.
আচ্ছা, I got your
So
point.
if we learn the basics, right, or
Mhm.
try to understand the medical legal aspects of things, like, so it would be like better for us to, like, apply in the exam scenario.
Okay, I got your point. Actually, it's very tough to talk about all the medical legal aspects in a single class. Actually, communication is a matter of practice. I mean, if I
Now, I
continue,
thought, like, for example, in this particular case, right?
yes. So in DNA CPR, আচ্ছা, এখানে
Yeah.
okay. So
So maybe, just simply discuss that, that DNS CPR is a decision from the treating team. So
yes,
they can refuse it, like, if a person has this thing, right, or they have this eliciting power of attorney, right, or like if they have advanced directive, they can deny it, but they cannot, like, demand it.
demand any treatment. হ্যাঁ,
Yeah, yeah,
এটা
yeah,
আর কি মেন ইয়েটা যে the
yeah.
patient can deny the treatment but he cannot demand. ঠিক আছে, এই কথাটা
Yes,
মনে
yes,
রাখতে হবে। আর ডিএনএ সিপিআর
exactly.
অ্যাকচুয়ালি ইট ইজ আ ট্রিটিং টিম ডিসিশন, দো হার মাদার এক্সপ্রেসড হার থটস, হ্যাঁ, before that she to do everything for her to keep her alive, but there was no advance directive. if advance directive এ যদি বলে থাকে সে ডিএনএ সিপিআর দিবে না, সে নিবে না, তার মানে আমরা দিব না। ঠিক আছে, এটা রিটেন ডকুমেন্ট থাকতে হবে। বাট এলপিএ যদি বলে ডিনাই করে ডিএনএ সিপিআর দিবেন না, তাহলে এলপি এর কথাটা কি করা যাবে না, মানা যাবে না। কারণ মানে এখানে ট্রিটিং টিম যেটা ভালো ডিসিশন নেবে সেটাই আর কি পেশেন্টের জন্য। সো এটা মনে রাখতে হবে, ডিএনএ সিপিআর ইজ আ treating team decision, but the decision is not final. It can be reviewed if the patient shows signs symptoms of improvement. But DNA CPR doesn't mean that end of life care. এটাও ইয়া করা যাবে না, মানে এটাও ভাবা যাবে না আর কি, ঠিক আছে। বাট এটা আপনি মানে পেশেন্টকে আপনি ডিরেক্ট সারোগেটকে বলতে পারবেন না, ইট ইজ আ ট্রিটিং টিম ডিসিশন। এট ফার্স্ট আপনাকে মানে একটু ঘুরে পেঁচায় বলতে হবে যে অ্যাপ্রিসিয়েট অর আই রেসপেক্ট ইউর মাদার উইশ, and I can really understand that you want to do everything for your mother. I can understand that your mother's life is precious for you, but be sure that her life is also precious for us. Actually, this decision has taken by the consultant or the treating team in her best interest, as her condition is quite critical. Actually, not giving resuscitation is a treating team decision. বলে কেন দিব না? If we give her resuscitation, then it will cause more complications like breakage of the chest bone, bleeding inside the lungs, and there will be injury to the airways. And it will add her sufferings to her sufferings. And I hope that you don't want that. তখন ও এটা স্বাভাবিকভাবে চাবে না। তারপর এটাও বলে দিতে হবে, এই কথাটা খুবই ইম্পর্টেন্ট, that not giving CPR doesn't mean that we are not giving her any treatment, or we are not, we are letting her die. Rather, she is receiving all form of supportive treatment. We are continuously monitoring her conditions and we will keep you updated time to time. এভাবে যেতে হবে আর কি, ঠিক আছে। আচ্ছা, আমি চেষ্টা করব যে আসলে এই কমিউনিকেশন সিনারিও, এক একটা কমিউনিকেশন এক এক রকম। হ্যাঁ, আপনি যখন 3 থেকে 4 মাস ক্লাস করবেন, তখন বিভিন্ন সিনারিও যখন আপনি পারফর্ম করবেন বা যখন করাবো, তখন আসলে এই জিনিসগুলো ধরতে পারবেন। মানে একটা ক্লাসে it's very tough, to discuss all the medical legal aspects. There are lots of scenarios, lot of medical legal issues. It's
No,
better
no, no. I'm not
if
telling
you
you to, like, discuss everything. I'm just telling you to, like, maybe it's just 1 or 2 points here and there, right? When we are
yes, yes.
discussing a particular scenario,
Mhm.
maybe understand the basics, right?
Yes.
So whenever we are explaining a disease, particular disease, what format we can follow,
Okay.
right? We need
All
to,
right.
like, tell
Yes.
these, that, maybe, maybe follow a format rather than, like, uh, beating here and there, and, lose some concentration. And this happens to me all the time, right? that I'm telling something and then I forgot to tell other things, right? I forgot to mention complications. I
Mm-hmm.
forgot to mention particular treatment, right? So
Yes.
maybe, if we follow a particular pattern, right?
Then you will not
Then,
miss anything. I mean, you will cover everything in real exam. Like আমি আজকে ডিজিজ ডায়াগনোসিস সিনারিও করাইছি হ্যাঁ এখানে whenever you will get a disease diagnosis scenario, at first you need to explain the diagnosis. After that you need to, I mean, there is a common proforma. You need to after that you need to discuss about the cause and the other signs symptoms the patient might suffer from. Okay, then the complications and the treatment options. And later on you need to give leaflet and brochure so that you can get a better idea. If you follow this proforma in a disease diagnosis scenario, and I believe that you will not forget, I mean, these things, and everything will cover. And as the last scenario is a DNA CPR scenario, if you follow this proforma in every DNA CPR scenarios, I think I mean we will not forget these important things. মোরলেস সবকিছুই সেম ডিএনএ সিপিআর, জাস্ট আপনার ডায়াগনোসিসটা ভিন্ন হবে, বাট এই কনসার্ন গুলো, এই অ্যান্সার গুলো কিভাবে করবেন এগুলো সেম। ঠিক আছে, তাহলে আজকে শেষ করছি। হ্যাঁ,
ওকে।
ওকে, আসসালামু আলাইকুম সবাইকে, থ্যাংক ইউ।
আচ্ছা।